time now for our segment where we hope you will learn something. Doctor is in. We are so happy to be joined by Dr. Glenn Esses from the Vascular Center. Dr. Esses, thanks for being with us. Today we're talking about artery blockages.
That's right, Devin. And I think this is one thing that is under talked about, so it's a nice time for us to talk a little about blocked arteries in the leg and some of the symptoms that we see along with that.
So what are those common symptoms?
Usually someone has difficulty walking, so there's lack of circulation to the legs, and when you walk your muscles hurt because they don't have blood flow. In more advanced stages, we'll even see people have non-healing sores or even a toe that turns black, or gangrene, if we call it.
Does people often dismiss some of these symptoms thinking, oh, I pulled a muscle or I'm just sore for whatever reason?
Sure, of course they do. And some of these problems can be progressive, so they do need to be evaluated by someone who's properly trained and has a vascular surgeon, for example.
And how do you develop a clogged artery?
Our most common risk factors are cigarette smoking, diabetes, high blood pressure, and age.
Okay, so it's something that you could prevent possibly by not smoking, exercising,
That's
not
correct.
Getting old.
Not getting old is a tough one.
Can you tell us how to do that? No.
No, I have no advice for that.
So what do we do about a clogged artery?
Well, these days, luckily, we're able to treat a lot of these as an outpatient, and we're even bringing the patients into an office setting in our office. And we took a historic building and put a cath lab in our office, and a lot of this is just done through a needle stick.
That's it.
It's a very patient-friendly environment where you come in for several hours. The procedure itself takes about an hour, and we watch the patients a couple hours and they go home.
So you essentially unclog whatever artery is blocked?
Usually we can do that, of course not in every circumstance.
Okay, but at least you try to open it up a little bit.
That's correct.
Okay.
And as a surgeon, sometimes balloons work and sometimes we have to offer patients surgery or other things that are done in a hospital setting.
And that would be something then you would take the patient to the hospital and do?
That's correct.
Okay, well, we want all of you to be able to ask Dr. Esses questions about blocked arteries, peripheral artery disease, what causes these things, what can be done about them. So Dr. Esses is going to be joining us on Facebook Live right at 12:30. So if you want to log on to the WKRG page, you can do that, ask your questions, and then I will ask Dr. Esses anything you want to know about maybe pain in your legs, or a lot of people want to know, is this a varicose vein, is this a blocked artery? They might have a lot of questions about these things. So if you want to ask Dr. Esses, go ahead and log on to WKRG's Facebook fan page at 12:30. Dr. Esses, thanks so much for being our guest today.
Thank you, Devin. I appreciate you having me.